Hey lovely people, welcome back to my YouTube channel. So if you haven't been here already, welcome. So I'm the founder of Nurse Diaries. I'm a gynecology nurse. I'm also a content creator, and this channel is literally just about nursing, my nursing experience, tips that I share with you guys as well. I also talk about women's health, as I've got a very big passion for women's health and it's the field that I work in. I also sometimes have guest speakers come on here, and I'll be doing a lot of that this September, October time, so look out for that as well. And generally I also just show like what I do outside of nursing as well, because I feel like it's important to show the importance of having like a balance. So I also have some travel vlogs as well, that's up on my channel as well. So yeah, if you want to know about placement, if you're a student nurse, or if you are thinking of studying nursing, then I suggest you sit on tight and make sure you take notes in this video, as I will be discussing everything to do with placement, the teas, the good, the bad, etc. So keep watching to find out. So in this video I'm trying to be very real with you. So what to expect in your first year of nursing when you're on placement. So what to expect in your first year of nursing when you're on placement. So first year of nursing, I'm not gonna lie to you, it's not going to be you drawing up IVs, you being that girl that you saw on TikTok, you know. Let me be clear, it's not, you're not going to be doing that in the first year. I'm not going to lie to you. The first year is more about understanding what a nurse does, understanding the roles of a nurse, understanding that there's actually different health professionals as well within the field. It's not everybody that actually gets broadcasted as much as they should. Like, we have occupational therapists that we all work very closely with. We have the complex discharge team that we work very closely with. We have dietitians that we work very closely with as well. So it's understanding everybody's role, understanding how to actually look after a patient, how to clean their skin, how to assess skin, how to know when somebody's skin is breaking down, when they're getting a pressure sore, what a pressure sore even is, how we treat it. So I feel like first year is just understanding the basics. I know that people can be very eager to wanting to drop IVs, etc., but I think it's important to just bring it back to the basics, because you're just starting off. You want to learn how to do these things, because with these IVs and other stuff, you will learn it as you go on. Skills always expand, but understanding the normal basics of nursing, those are things that you may not learn again. You will learn, but you may not learn again, in the sense where, like, when you get to your second or third year, people may expect you to know these things, if that makes sense. If you don't, that is not a problem, and you should actually speak up and say, oh, I don't know this, I didn't have the opportunity to learn this, please can you teach me? That is something that you should never ever feel afraid to ask or to say, because if that is the case, then that is the case, and that person will teach you. At the same time, it is really important to, as a first year, not feel like, oh, I'm just doing this wash again, because I went through that, and I feel like it helped me in a sense where now when I'm working, I actually want to see my patient's skin. If someone's washing my patient, I will literally say to them, let me just pop in so that I can maybe help out, or I can actually assess their skin, because I feel like it's important as a nurse to know how the patient's skin looks like. You can't just document if you don't know. So that is one thing that is really important, that I always try and explain that to students. So first year is more about understanding the basics, and then yeah. And I'm not saying the entire first year, first placement definitely, but first year, almost at the end of your final placement, etc., for first year, of course you're going to be expanding and doing other things as well. So don't think I mean just first year, the entire first year. No, I'm just talking specifically at first year, first placement, because I know that we have perception of nurses just doing injections and that's it, but there is more to nursing than just administering IVs. Second year, you are in the floating section of placement, because there's things that you can do, and there's things that we're still going to challenge you and be like, do you know how to do this? Do you want us to help you? And I feel like you shouldn't get offended because you're still in your second year, you're in the middle, and I feel like you shouldn't feel overconfident, because I feel like there's always room to learn new things. So don't feel like when you're in your second year you know it all because you're going to your final. It doesn't mean that. I feel like it's always good, even if you know something, to ask that question again. I feel like every nurse that you work with works extremely differently, so it's good to ask questions, because then you can actually get really good answers and actually enhance your knowledge. That's what clever people do. They ask questions to different people so that they actually have a broader understanding of what it is that they have actually been taught. Now, final year placement student is given independent. A final year placement student, you are not expected still to know everything. I feel like final year students give themselves a lot of stress in thinking that they must know everything, and they shouldn't be asking questions because somebody's going to ask them, how do you not know that, and you're in your final year. Personally, I would never ask that, because at the end of the day, you don't have your PIN yet, you are still a student. That student name still stands. Yes, you are working more independently, but you're still working under supervision. Even if it's a minimal supervision, supervision is still in the name. So yeah, you will be expected to take patients under minimal supervision and understand like how to look after them, how to escalate what needs to be escalated, how to discharge, how to admit. And sometimes it can be overwhelming taking care of your own patients. But I feel like it's really important to actually do it, just so you can feel more comfortable. So I feel like when nurses are actually asking students to do it, don't feel like, oh, they're being mean to you, they're picking on you. I don't see it as that. I see it as somebody trying to really push you so that when you actually do qualify, you feel more comfortable doing things on your own. Of course, that nurse shouldn't actually leave you completely to do everything and never be there for you. If they're around and they're saying that they're happy to help you, or so most of the time they end up like just overseeing what you're doing anyways. So yeah, why not? We all know about placement, like we've all heard about placement, but what really is it? So placement is when you are allocated to go to a hospital where you work as a student for free, and you're basically shadowing a registered nurse. So placement, it depends on what area you're in. Not all the time can your placement be located in a hospital. It can sometimes be located in a community setting, etc. So yeah, depending on where you're located, it's depending on how long your shift hours are. You're really shadowing that individual that you're working with. So whatever their hours are is exactly what your hours will be. So with placement, I know a lot of people have questions like, are you allocate any kind of placement? Do you choose what kind of placement? So when you first start your nursing course, you have to do like an occupational health test. So you have to say like any conditions that you may have, etc. And it's important to really declare anything that you do have, because if you do end up going somewhere, maybe for example, if it's an infectious ward, and then you start talking about health problems, of course that's absolutely fine to talk about if you know you do have something wrong, but it's just important just to clear it out from the beginning. I feel like but yeah, so you can basically be put anywhere. The university choose where they want to put you, which sometimes is not fair, because like, I don't know, you don't have a choice, if that makes sense. Like, you have to go, even if you don't like the ward, like you have to just be there until your placement finishes. But yeah, essentially that's how it is. So you go to a placement. For example, my first placement as a first year student was on a surgical ward, which I absolutely loved. I liked the atmosphere. I liked my assessor was just, he was the most inspiring person ever, and even to this day, like, he's still, I want to be like him now. I want people to think of me like how I speak so highly to this day of him, and that was like, I don't even know how many years ago. But yeah, you go to placement, and when you go on placement, you are allocated an assessor and two supervisors. So your assessor is the person who's really like your main mentor, and then the other two are like your sub mentors, meaning that your assessor you go to for like questions, they fill in your book with you, but your supervisors also can fill in your books with you as well from university packs, or if it's online. I don't know, you guys now do ePads. Yeah, it can be filled in by supervisors and assessors as well. So don't think that your assessors have to do everything. Make sure you read the ePad properly, because there's times where it says supervisor or assessor, and that means either. So sometimes I feel like, as an assessor myself now, a lot of the times I get students saying that they were waiting for me to do A, B, and C, and it clearly states that it can be done by either supervisor and assessor. So if you are working with your supervisor more than your assessor, and there are things that your supervisor can fill in, it is important to just get them to fill it out, just so that it's easier to facilitate when you do see your assessor, if that makes sense. But yeah, so placement is, it can be, I don't know, every university is a bit different, because where I went, we had our 6-week placements, 8-week placements, but there are universities that I'm seeing now when I'm working as a registered nurse, I'm seeing students come for only 3 weeks, 4 weeks, 2 weeks. Yeah, so I feel like things have changed a bit when it comes to placement length. I'm not sure, but yeah. So if you have a placement and you're on the wards, you're gonna have a 12.5-hour shift. And when you're on that shift, you are shadowing a nurse, and that's why they like to give you assessors and supervisors, just so that you can feel comfortable in the environment you're in, and you can like be familiar with this, with working with certain individuals. And I feel like that is a good idea, because everybody works differently, and I feel like if you feel comfortable with somebody and you've got a good rapport with them, then why not work with them, or try and build that rapport with them, so that when you are doing things, you feel comfortable talking to them, asking them questions, etc. My advice would be, from day one, the first day you go to your placement, make sure you just come correct with having a notebook, being eager to learn, being eager to ask questions. I think it's very important. I see students, now that I'm a qualified nurse, for almost 2 years now, I see students who do come, but they don't have a pen, they seem a bit unorganized. I just don't think it's a good look. I think it's important to really just present yourself as ready and eager to learn. And I always used to think, to myself, well, I was told myself, when I was a student, that at the end of the day, you're here to do your hours and you're here to learn. So make the most of it. You're there to learn, so why not have a simple book and a pen? Do you get what I mean? If you think of it like that, then it will help you to ensure that you actually do go to placement prepared. So yeah, that is very important. I feel like, don't be shy to bring out your pen and notebook and write things down. You cannot retain everything that somebody's going to teach you in a 12.5-hour shift. And definitely, if you don't have a pen and a paper, I say a little notebook, then how are you going to retain the information for your entire placement? Like, no. So make sure that is done. Another thing is, with placements, you can be put anywhere. I remember when I was a student in my second year, I was allocated in a completely different city. Not city, I don't know how it is in London, because my university was outside of London, and it was really, I felt a bit scared at times, only because like when it was winter times, it was really, really dark. I'm outside of London, in an area where there is nobody around, and outside of London the buses take maybe 30-40 minutes or 1 hour. Sometimes the buses never came to go to placement. It was just horrific. There's times where, as a student, bearing in mind I wasn't getting paid to go to placement, I wasn't getting paid for these hours, I sometimes had to sacrifice getting an Uber, because I felt like I didn't want to be behind on my hours because the bus didn't come. And sometimes it's hard, because you go to your placement and then they don't understand the fact that you woke up so early, you're not getting paid, you're consuming your money, whether you have to sacrifice taking an Uber, or even if you're taking the bus, it's still your money that you're consuming. So it's really, really hard. I know that there is a fund that the government have put in place, a bursary, so that you can basically helps to pay for your travel expenses. However, one thing I will say is that the money never comes at the time that your placement is allocated, if that makes sense. Like, so the money would come after, and it's like, regardless, like, you'd still have to fund for your placement travel prior to that money even coming into your account, if that makes any sense. So it is very hard and challenging. I found myself actually doing, like, working on the weekends when I could, on the side, just so that I could find enough money to actually fund for my travel for placement, because as a full-time student who's also traveling to go to placement, it just wasn't making any sense. But yeah, so travel is really important that you just have, like, I don't know, it's really important that if you know somebody who is traveling to placement or going to placement, you can speak to them on your way to placement. I think it's important. That's what I was always doing, just because it is a bit I wouldn't say unsafe, but it's a bit scary to just be like in a new environment that you don't know, and it's pitch black outside when it's winter, and there's possibly almost nobody around. So yeah, it is hard. I literally remember waking up at 4 a.m, leaving the house at 5 a.m, traveling around 2 hours time or more to get to placement. And my colleagues, I would say my colleagues, but the people who I was working with at the time when I was a student would, like, literally just look at me as if, like, or sometimes the bus wouldn't come and I'd also be late. Bear in mind, I left the house at 5 a.m and placement started at like 7:45. So I would probably leave way earlier than they ever left, or where they were probably still in bed. Like, I remember one time we did have a discussion, oh, what time do you leave the house? What time do you leave the house? And I'd be like 5 a.m. and they were all shocked. And I was like, yeah. And they were like, but you don't even get paid to be here. And I'm like, yeah, but I have no choice. So it is hard, and I can resonate for students who actually do end up getting placements far away. So that's something just be very mindful of, and always have somebody that you can speak to on your journeys, because it is quite dangerous, I would say. So yeah, just never be, if you are alone, just make sure you have, like, at least a pendant with you, like something that makes noise. Stay safe always. Yeah, so with placement, it can be exhausting, but just make sure you make the most of it. It's hard to keep pushing, but just keep pushing. Just say to yourself, this is what like, it's hard, but, like, just think of your hours. Your hours contribute to the end, because you need those 2,300 hours to qualify as a nurse. And that's what I always said to myself, and I always had that mentality. Even when there were places that I really disliked, I really didn't want to be there, but I just tried my hardest, because I knew that my goal was to qualify as a nurse, and that's exactly what I did. So yeah, I think it's also important to be very mindful of not falling into the trap of buying, like, food on your break. A lot of the time, like, hospitals have, like, Costa or, like, stuff like that, and you see colleagues or people you're working with going to buy their tea or their coffee, etc. I feel like that's a dangerous trap to fall into as a student, and the only reason why I'm saying it, calling it a trap, is because if you realize, like, Costa is not cheap. Like, you'll buy things for like £5, £10, etc. And as a student already who's struggling to make ends meet with paying for their placements, yeah, just be responsible and mindful of what you're doing. I feel like that's why I did start, when I was a student, trying to do my prep meals. Even as a qualified nurse now, I think if you haven't already, make sure you do watch my vlogs, because I did actually do a vlog where I was making my prep food for work. I think it's important to just be very disciplined on that, only because hospital food is always expensive. I don't know why, but it always is. So I feel like just don't waste your money on things when you can actually do them yourself. I know it's hard to said and done, because not every time, it's not all the time that you have enough time to make yourself some food. But if you can, just do, because you'll save so much. And especially in this financial crisis, it's actually important to save as much as you can, and that is definitely a way to actually save. So yeah, if you are watching this and you are always buying coffee or hot chocolate or whatever it is that you drink, or you don't make yourself food but you're buying a sandwich, like try and do it yourself. Like I promise you, you will save a lot, and then later come back to this video and thank me. But yeah, so that is really important as well. Yes, I feel like I've disclosed what you need to know about placement. Oh yeah, also sometimes like you may actually have assignments due whilst you're still on placement as well, so it can be quite hard. So I feel like if that is the case, just try and speak to whoever you need to speak to, just to make sure that your shift patterns are not insane, so you actually have time to study as well, because I know it can be hard. I remember there was a time where I had an assignment and I was also in placement. I was honestly so fatigued and it really did present. And I literally just told myself, so like I have a lot of assignments to do. I'm not asking for time off because obviously I know that I need to make my placement hours. But I just made sure that my shift pattern, my shifts weren't so like condensed together that I didn't have time to revise, or I didn't have time to do the sum I needed to do. So that is, it's important to communicate. Like I feel like with placement, the main thing is communication. Communicate with everyone you need to communicate with, and never ever leave your EPAD to the last minute. If you're in your first year, listen closely. If you're in the second year, listen closely. And if you're in your final year, listen closely. Like just never ever 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 leave your book to last minute, because it's stress for you and it's stress for everybody else. So please just don't do that. But yeah, I feel like I've spilled the tea with placement, to be honest. Just always be open to ask questions, and if you don't feel comfortable with something, always speak up. Speak to somebody that you can speak to in the environment. Yeah. If you like this video, please give it a thumbs up and subscribe if you haven't already. It's September, so we are really going to be in the nursing spirit. Like we are going to be posting nursing stuff. I've got a few things coming up and projects, and you'll be seeing different faces on here as well. Not only September but throughout the new academic year. And if you are new to the channel, please do subscribe, and I hope you do like this video. Make sure you tune in to the next week's video as well. It'll be amazing. Thank you so much for watching. Bye guys.